Preoperative imaging and planning for robotic facet decortication, robotic decompression, screw and cage placement. A preoperative CT scan can be loaded into the software before the surgical procedure, enhancing operating room efficiency. Alternatively, just before the initial incision, an intraoperative scan and plan step can be performed. Surgical planning software. The software offers a pre-definition of pedicle screw trajectories, decortication of facet joints, and decompression before making the surgical incision. The robotic registration process includes the facet joints and the lamina, allowing for planned decompressions medially to the facet joint, including the lamina. The decompression software model comprises the proposed defect, green, and a 5 mm safety margin, red, to prevent inadvertent injury to surrounding structures. The depth of penetration can be adjustable, ranging from 8 to 20 millimeters. Real-time views and planning. The software provides real-time axial, sagittal, and coronal views of the patient's anatomy through optical motion capture arrays on the surgical instruments. These views are used to plan screw placement, cage positioning, and surgical resection for facet joint decortication and decompression. Facet joint decortication. In the context of facet joint decortication, it's critical to start from a bone entry point, bearing in mind that the diameter of the drill bit is fixed, while its depth of penetration can be adjusted. The model includes the proposed defect, shown in green, and a 5 mm safety margin, shown in red, to prevent injury to neural structures. Additionally, two numbers are displayed, one in millimeters indicating the entry point's distance from the midline, and an angle in degrees representing the burring channel's current angle relative to the midline. The defect model has a fixed diameter of 7.5 millimeters, while the depth is adjustable between 8 and 20 millimeters for precise planning. Decompression. Decompression involves utilizing the navigated bone removal drill to effectively facilitate bony decompression. An eggshell technique can be used where the lamina or facet joint that needs to be decompressed is removed, except for 1 or 2 millimeters closest to the thecal sac or nerve roots is preserved. Based on the desired side of facetectomy and decompression for interbody cage placement, plan for multiple defects of the superior facet up to the posterior disc. For decompression more central from the facet joint, such as the lamina, additional defects can be planned for canal or lateral recess decompression. The decompression software model includes the proposed defect, shown in green, and a 5 mm safety margin, shown in red. Additionally, the depth of penetration can be adjusted from 8 to 20 millimeters. Cage. The interbody cage can be selected and positioned on the software depending on the specific surgical technique employed and the patient's underlying pathology. Selection of bone graft type should be considered and can be introduced into the disc space and contralateral facet joint during the surgical procedure. Instruments such as a funnel-shaped cannula can be utilized to deliver autograft or allograft to these sites. Screw planning. Each screw can be planned manually for trajectories, including entry points as well as thickness based on the pedicle's diameter.